Hello and welcome. This is Facebook Live. I'm coming to you from my home office. My name is Jillian Price. I am the Chief Audiologist with HearingLife Canada. We're going to get started. We have one more minute until it's officially 2, but I just wanted to get on and say hello, everyone, and thank you so much for spending some time with me today. It's a pretty big month in my world because the month of May is actually Hearing Awareness Month. So it's a big month for us. We talk about hearing a lot in the month of May, and we really try and get out there and educate you. Of course, before the pandemic, it would have been really nice to be in person, but we have to use what we have, and the facilities of the internet are wonderful, and the virtual platform is a way that I can actually reach more people at the same time, because you can be anywhere and be able to get this information from the comfort of your home. So that's not necessarily a bad thing, right? So I do look at it as a good thing that I can reach you all and give you this information. It is Hearing Awareness Month. Lots happens in this month in terms of in the world of audiology. So, this is where we want to be, right? It seems like ages ago where we could do this, right? Be together in person, socially connected, having a laugh, having a good time, being able to see each other and communicate ideally. This is the ideal way. But our reality for over a year now is this. And so today I'm going to touch on how that actually impacts us, not just for those with hearing loss, but I mean, all of us in general. This has been a really difficult time. It's been over a year, and our interactions with people look a lot like the picture on the left, which is we have to be apart from each other. So we increase the distance, and we can't be connected face to face like we want to be. We are isolated or on lockdown. So this is our reality right now. And, the things that have come up in the last year, what people have been asking me, does have a lot to do with the pandemic and how things are affecting us. So I'm going to talk to you about the most frequently asked questions over the last year that I have received. And I'm going to give you some good tips on how you can make the most out of your hearing. Talk about how hearing actually just impacts your overall health. And then talk a little bit about treatment. So what can you do? And is this the right time? Is during a pandemic, is this the time to be doing something about it? So I'll probably be talking to you for about a half an hour. A few housekeeping things that I wanted to let you know is that we are welcoming any questions you might have. So you can, at any time, while I'm doing this chat with you, you can post questions if you have any questions at all. We have Patrick that's going to monitor this while I'm talking to you, and he is very knowledgeable. He's an hearing instrument specialist, so you can ask away any questions you might have, and he will answer those questions for you. And we'll also be posting some links to help you get some information where you can go and peruse after this session is over. So please just don't hesitate. If you have a question, you can post it in the chat box. And we're also going to leave some time at the end for any questions you might have about anything I talk about. So I hope you're comfortable. Get comfy, maybe a hot or cold beverage, and sit back and relax, and we'll get some information about hearing and why it's so important, especially during the month of May when we celebrate hearing awareness. So let's get started. I wanted to start off just by giving you some information about how COVID-19 actually affects our hearing. What has been going on with us? So much has been going on, but how is it specifically affecting us in terms of our hearing? So we know that COVID has brought a lot of challenges, emotionally, psychologically, physically. We are living in a different world now. So how does that affect our hearing? Well, everybody is struggling a bit to hear because the conditions aren't ideal. But those with hearing loss, they really rely more on sight to sort of fill in the blanks for what they can't hear. And that has all changed now. And we've really removed those cues that help those that are having difficulty hearing with their ears. So what I'm talking about is really masks. So how does wearing a mask affect us in how we communicate with people? Here are the three things that come about when we are, forced to wear masks when we communicate with people in the outside world. All of us actually lip read. So even if you don't have trouble hearing, we all use lip reading cues. We use the cues of when people are speaking to help fill in the blanks, or at least to confirm that what we are hearing with our ears is actually what we're hearing. I'll give you an example, and this is for everybody. How you know that your brain uses what your eyes are seeing and then confirms that with what you're hearing. So if you've ever watched a TV program, when the audio track is a little bit off, so whether it be that it's a little delayed or it's just not matching up with the person's lips, what they're pronouncing, it's very noticeable and also very distracting. And it's sort of like you can't just ignore it. It distracts you to the point that it makes it very difficult to continue watching the program if there's a mix match. That's the brain's way of telling you that it needs to have those two in sync. So what it sees with your eyes and what it hears with your ears need to match up. Well, if we can't lip read, if we can't see somebody, then we don't have that cue to rely on anymore. And people who have hearing loss really do rely on these cues more heavily than somebody without hearing loss. When we put a mask on, we completely eliminate that. And that makes things really difficult because you then are forced to rely on your ears alone when you would have been able to use lip reading. The second thing that happens when you wear a mask is that the sound of your own voice gets muffled. So the intensity or volume of your voice is decreased or reduced when you put a mask on. So that also makes it more difficult for somebody who's already struggling to hear when you've muffled the sounds or you've reduced the intensity. So, and I think all of us, if you're at the grocery store, it's just harder to hear people when they're speaking under a mask. And finally, we have facial expressions. So right now you can see me and you can see when I smile or if I frown or if I look angry or happy, but that helps you to make sense of what I'm saying. So when your ears don't give you all the cues, facial expressions can sometimes fill in the blanks to confirm that what you think you heard is what you heard, because my facial expression is matching what I'm saying. All these things are either eliminated or greatly reduced when we have to wear masks. So we can see how this has been quite difficult and how this is affecting people who struggle to hear, just trying to communicate in this world of COVID-19. And I've been asked quite often, does COVID-19 make hearing loss worse? Well, since this is, although it feels like forever, it is fairly recent. So there's not a whole lot of research, or at least there's not long-term research to indicate how COVID-19 affects our hearing long-term. But there have been some studies conducted, and a British study was conducted where the scientists estimated that it's about 8% of those who contract the virus will experience hearing loss. So it's not a common side effect or reaction to the virus, but it has been reported. What is more important, I think, and what all of us are experiencing is that just the fact that we're isolated and forced to isolate, it's causing increases and higher risks of depression and anxiety and stress. So we are all a little more stressed and a little more susceptible to this right now, given the fact that we are so socially isolated. So we have to just keep that in mind. If you add on top of that, that you're not hearing very well, or you're having difficulties, that you are exacerbating that. So we want to really keep in touch with our mental state, our emotional state, and do everything we can to try to improve that, not make things harder. There is some evidence that the virus can cause either an increase in tinnitus or create tinnitus or cause tinnitus. And so if you've never heard that word, it's also pronounced tinnitus. And I am going to talk a little bit about that in a bit, but essentially it is a ringing or buzzing in the ears that is not created from an outside source. So it's coming from your head, and many Canadians do suffer from this. And so there is some evidence that if you contract the virus, that it can increase it or cause it. There are some reports of tinnitus after receiving the vaccine. So there have been some reports with the Pfizer and the Moderna vaccine, individuals, some reporting that they are experiencing tinnitus as a result of being vaccinated. There is no evidence that the vaccine causes hearing loss. So in summary, based on the research that we have so far, it is still my recommendation, and you know, we as healthcare professionals would still recommend that you get the vaccine, and that it is, you are not putting yourself at an increased or heightened risk, because in cases where it has affected your hearing or creates tinnitus is quite low. Okay, let's move on to some tips for how you can hear your best during this current state of the pandemic. So this is a screenshot of really my world for the last year or more, that, you know, this is a Zoom call, I'm in meetings all day, and this is how I connect with my coworkers. We try to make the best of it, and you can have a little fun on these calls, but really, if we can't be together in person, this type of communication is really ideal. It's ideal, and I'm going to tell you why it's ideal. And I'm going to give you some tips on how to really make sure that you're hearing your best. The first thing is, for all of you out there who wear hearing aids, make sure they're working. That's the very first thing you can do. So keep your hearing aids in good working order. And I'm here to let you know that our clinics are open during this time. So we are there to assist you. We are considered an essential service. So across Canada, our clinics do remain open. We have very strict protocols in place to ensure that we are providing a safe environment for our clients, but you can come see us in person. We are accepting appointments, but it's by appointment only. So our doors are locked, and we are seeing each client one at a time to keep the numbers low in their clinics, to make sure everybody is safe. Proper PPE is being worn, and you will be screened ahead of time, but we are there to serve you. So if you do need to come in and see us to get a hearing test, to receive your hearing aids, we are there to help you in person. But that's not the only way. So what if you can't go out? And we understand that there are many of you who are either choosing to, you know, only go out if it's an emergency, you're in lockdown, or you just can't get out. So we have lots of options for you. If you have a friend or family member, you can arrange for them to come and pick up anything that you need. We have curbside service. So you can, if you're having an issue with your hearing aid, you can drop it off. We will take a look at it, do cleanings, repairs, adjustments, and then you can come back and pick it up. So all safely done, and you don't even have to enter the clinic. We will offer this at curbside. And if you can't do that, if you need some supplies such as batteries, we will mail them to you. So we are also taking advantage of mailing postal services to ensure that you have the supplies that you need. So we are doing everything we can to make sure that we service all of our clients in any way possible, whether it be remotely, in person, or curbside. We're there to help you. We also have other ways to help you through the wonderful world of the internet. So just as it's giving me the chance to come to you right now and to talk to you, I can also provide support in other ways by, if you want to take advantage of our online services. We have some really wonderful resources that are available at your fingertips anytime. So there are three that I just wanted to mention to you and bring up. The first is our telehealth services. So this is our remote assistance. So if you want to either chat with somebody live, or you want to chat with somebody via email, or you would like to do a video call, we have all of these available for you. And we have hearing healthcare professionals ready to help you. So you'll be speaking to someone who is a hearing healthcare professional and can definitely assist you in your hearing needs. You can access this by, probably the easiest way is just to go to our website. So that is HearingLife.ca. And we will put that in the chat box for you, a link so that you can access that. There are many ways to book an appointment. You could also book a video conference or consultation, and we'd be happy to assist you. The other resources that we have, I would consider more self-help. If you want to just search up a topic, there is a fantastic resource that we have, and we have really expanded this resource as a result of the pandemic. We knew we had to find ways to get this information out to you and to assist our clients as best we could. So we have hearingaidhelp.ca. We'll put that again in the chat box for you, but it's a wonderful resource. There's a couple different ways that you can access information. You're going to start by entering the homepage, which will say, what would you like help with? And if you just want to put in any question at all that you have, so for example, let's say, how do I change a battery? If you type in, how do I change a battery? Then a list of articles and videos will pop up for you to access. And you can take the tutorials, read the articles, watch the videos on the topic that you entered. If you just want to peruse and have a look at what's available, there is a suggested list of really common, frequently asked questions. So there'll be some suggested articles for you to have a look at. So if it's just maybe not one particular thing you want to research, but you want to just get some general information, then you can select from the list that will populate. So I strongly encourage you to have a look at this website. Most of the questions that people have, we can answer them on this self-help website, and there's some really good articles. I encourage you to have a look. You also can book a virtual appointment this way as well. So if you've read an article but you still have a couple of questions and you'd like to speak to somebody live, then you can arrange for that, and we'd be happy to help you. And then lastly is our HearingLife shop. Again, because of the pandemic, we needed to find ways that we could offer our services and get things, our supplies, out to our clients remotely. And that's why we have this HearingLife shop. We've added a lot more items over the past year to ensure that you have all the supplies you need. So if you go to hearinglifeshop.ca, then you can order supplies and accessories, add them to your shopping cart, and have them shipped directly to your home. And again, we'll put that in the link as well in the chat box so that you can access that whenever you want. It's a great resource as well. And then I think really for all of us, the most important tip that I can give you to hear your best during the pandemic is to just try to stay in touch with people, because we are isolated and that really does take its toll. So you just got to do whatever you can to stay connected to the people that aren't in your home, that you're not living with. You know, I think that this platform is one of the best. And the reason why is because when you do virtual like this, whether you use FaceTime or Zoom or Skype, what it allows you to do is see the person's face, which I've already explained why it's so important that we need to see each other's faces when we're communicating. You don't have to wear a mask when you're speaking virtually. So I really recommend that this is the best way to communicate with people when you can't do it in person or when you have to wear a mask. So I get on board, make those calls to your friends and family, try it out. It will allow you to hear your best because you'll be able to do it without a mask. What I would recommend though is, you know, we've been in this for a while, and I think that the way things are going to be different for a long time. So I would recommend though that you invest in a good quality set of earphones or headphones. So, I use these. I'm in meetings all day. And although I don't have a hearing loss, I always conduct my meetings with these in my ears. They actually fit a lot like hearing aids. They just pop right into my ears like so. They're nice and secure. And what it allows me to do is only hear whoever I'm having the call with, and it blocks out the background noise. I can adjust the volume so that it's perfect for me and the voices come in nice and clear. So I would recommend that you invest in good quality earphones or earbuds or a headset. Because it will definitely help in terms of the clarity of the sound coming through. You want good lighting. You want to make sure that who you're speaking to is well lit so that you can use lip reading and facial cues to help you fill in the blanks. And if you wear hearing aids, make sure you're wearing your hearing aids, or again, a very good quality headset or earphones. Okay, let's switch topics. I wanted to spend just a few minutes talking about your overall health, because hearing really does affect more than just, the ability to hear a sound. It's so much more than that. And I wanted to make sure that you have some information about how this affects other health conditions that you may be experiencing. So before I talk about those, hearing, Helen Keller is kind of our ambassador in the audiology world. She said, she has a quote, and we use it quite often. She said, blindness separates us from things, but deafness separates us from people. And I think that's very powerful because it speaks to how much we as human beings are socially connected to each other, and that it's how we feel that we're part of something, and how we communicate with each other is through our voices, and we need our hearing to do that. So it's a communication disorder because we communicate with each other. So important. So hearing doesn't only just affect, your ability to hear sounds, but it's also important to recognize that you could be at risk if you have other health conditions. The big one for a lot of Canadians, because a lot of Canadians suffer from this, is diabetes. So it's good for you to know that if you do have diabetes, you're twice as likely to have hearing loss compared to those who don't have diabetes. So if you have diabetes, I strongly encourage you to get your hearing checked and to monitor it over time, because changes in your diabetes could be affecting your hearing as well. You want to make sure that you're, of course, keeping your diabetes in check and you're staying healthy and keeping your blood sugar levels in control, but just know that your hearing could be affected and you want to make sure that you're getting that checked and that you're staying on top of it. Also, kidney disease. So if you are someone who has kidney disease, then you're also, much more at risk of hearing loss, and you want to make sure that you have that added to your wellness checklist, that you get your hearing checked. Hypertension. So if you know you have high blood pressure, there's a link between high blood pressure and hearing loss. So again, if that's you, make sure that you get your hearing checked, you put it on your wellness checklist, and you're monitoring your hearing because it could be affecting it. And then lastly, Alzheimer's and dementia. So in the past years, this has really been a hot topic in my field because a lot of research has been going on with hearing loss and cognitive decline, and how the brain and the ear are connected, and how much effort it takes to actually process sound. So hearing loss has been identified as the greatest modifiable risk factor for dementia in midlife. So what that means is that of anything that you can do to lower your risk of developing dementia in midlife, treating your hearing loss, preventing hearing loss, reducing the risk of hearing loss is the most modifiable risk factor. You actually can do something about it. So important to keep hearing top of mind. Make sure you get it checked. And we would say, age 60 and over for sure, but I would recommend anybody in their adult life should get their hearing tested. Also, this is linear. So what that means is that the greater the hearing loss, the greater the risk. So your risk of developing dementia increases as your hearing loss gets worse. So it's not something you want to wait on. You want to take care of this as soon as you can and take action. Also, just your overall safety, balance, that is affected by hearing loss. So those with hearing loss are at least 3 times more likely to have a history of falling. So it's about spatial awareness and the perception of the world around you, and it can affect your balance. So it's really important to be aware of what's going on around you. And that's, if you are struggling to hear or you have hearing loss, that's why treating your hearing loss is really important and not something that you should wait to do. Okay, so I said I'd come back to tinnitus, and I'm going to. So it is something I get asked almost every time I do something like this, or I educate the public. I get asked about tinnitus because there's a lot of Canadians actually suffering with tinnitus. So let me talk about it a little bit now. So what is it? Tinnitus, tinnitus, you can say it either way. It is the perception of sound when no sound is present. So the sound is actually not coming from your outside environment. It's coming from somewhere in your head. It can sound like a ringing, a clicking, a hissing, or a buzzing, and it can be quite debilitating if severe. Tinnitus is not a disease in and of itself. So it's not a disease on its own. It is actually a symptom that results from a variety of underlying conditions, mainly hearing loss. So the most common cause of tinnitus is actually hearing loss. About 1 in 10 Canadians experience tinnitus, and of those, about 90% also have hearing loss. So again, the biggest cause of tinnitus would be that there is damage to the auditory system and that there's some hearing loss present. So if you have tinnitus, I highly, highly recommend that you get your hearing checked. You could be experiencing some hearing loss. There could be some auditory damage, and you want to make sure that you get that checked out. So call and make an appointment, come see us at HearingLife, and we will do an evaluation to determine whether or not you have any hearing loss if you are experiencing tinnitus. What actually makes tinnitus worse? There are some things that we know can, aggravate it, increase the intensity or volume. And here are some listed for you. With the prescription drugs, you just want to, if you do take medications regularly, you just want to make sure that tinnitus isn't a side effect, because it is a common side effect for a lot of medications. If it is, and you want to maybe speak to your family doctor about either possibly changing your medication or maybe exploring a different dose. Also, just diet. I mean, you can do some changes, temporary changes, by eliminating some things in your diet, like high salt, caffeine, alcohol, and see if it makes a difference. Yeah, you might notice that your tinnitus, really drops down and reduces, or it's not bothering you as much if you just make some changes to your lifestyle. So here are some of the things that you can try. But what can you do? What are the treatments? I often get asked, what can I do about this? And the good news is that if you are someone who has tinnitus and hearing loss, you can actually treat both conditions with one device, and that is a hearing aid. About 70% actually find relief just by wearing hearing aids. So you get to sort of, fix 2 conditions with one device, and that's really a positive. The reason why wearing a hearing aid can help with tinnitus is because you're receiving amplified sounds, and that stimulates the brain and takes the focus away from the tinnitus. So you're essentially masking the sounds that you would normally hear and focus on and fixate on. But you've got now environmental sounds coming around you, and that sort of just covers it up, and you focus on that instead. So there is relief that can be found just simply by treating your hearing loss and wearing hearing aids consistently. Okay, so is right now the right time to treat hearing loss during a pandemic? Is this when we should be doing something about it? Well, my answer is yes, it's right now. Right now. and more so than ever, because I think after listening to me now, you would understand that we have less cues available to us to help us hear better. And this is for everybody. This just isn't just for people who struggle, but we have less cues because of mask wearing and because we can't be face to face a lot of the times when we want to communicate. So we want to give ourselves as much help as we possibly can. So if you're struggling to hear, a hearing aid will help you hear the sounds around you and will help you communicate and stay connected. But what is the reality? Well, the reality is that it takes, on average, about 7 years for someone to do something. And that's pretty alarming, because when you think about it, why would it take so long? If you know you have a hearing loss and you know there's something out there that can help you, why does it take people so long to do something? Well, there are some reasons for it, and I think one of the things that we have to face is that there's a lot of denial. A lot of the times, the person with hearing loss isn't even aware that they're having a problem. And the reason for that is hearing loss tends to be very gradual, so it happens over time. It happens slowly. So the person who is having difficulty doesn't even really know what they're missing, because they're not hearing it. To them, they're hearing the world as it is. And it's usually not till somebody else around them tells them, I don't know if you're hearing as well as you used to, that they go, oh, okay, maybe I'm not. So it's often friends and family members who tell somebody that they might be having a problem. And yes, there is a social stigma associated with wearing a hearing aid. I wish that it wasn't true, and I wish I could say things are so much better now, but there does seem to be this stigma that it's related to somehow it's a symbol or a sign of, getting older, or a sign of aging, that a part of you isn't working as well as it used to. And so some people are reluctant to wear a hearing aid, or are not overly motivated. And I think this sort of mentality is very common. It's like, I can get by. I'm doing fine. I can make do. Again, because it's gradual, that it doesn't seem to be that it's urgent, or that it needs to be handled right away. So you just sort of put it off, right? That I can get by. But what I can tell you from my years of clinical experience, I've been an audiologist for 17 years, is that the thing I hear the most is, I wish I'd done this sooner. I can't believe how much I'm missing. I was really making it so much harder on myself. This is so much better. I just wish I had done this years ago. So hearing aids definitely help. They work. And what they do is they take the work off of you and off your brain. So there's a lot of fatigue involved and a lot of effort that needs to go into hearing all day when you have a hearing loss and it's untreated. And you're straining all day long, and that takes energy that you could be using for something else. So you're tired at the end of the day. You're tired of straining. You're tired of listening. The hearing aid will take the work off of you, and then you can just relax and have some energy back. It also helps improve self-esteem and confidence, because you're not feeling that you're missing things, or that feeling of embarrassment when you do, or when you're not following the conversation. It usually leads to sort of a feeling of overall improved well-being and positive lifestyle changes, being more socially engaged, more active physically and socially. And your family is also positively affected. If you think that your family is not affected by your hearing loss, I'm here to tell you that you're wrong. I have spoken to enough spouses and children to let you know that your hearing loss affects them too. There's frustration on both sides. So not only are you helping yourself, but you're going to be helping your family as well, and the people that you live with. Okay, so we're just wrapping up here, and I just want to let you know that in celebration of May, which is Hearing Awareness Month, we have a few rewards, incentives, promotions going on if you visit us in the clinic or if you seek our services. So let me just go through them. We have twice the air miles for your first hearing test if you come in and get your hearing test, 10 air miles if you complete an online hearing test, so that's available too. We have 5 miles for every $10 spent, and that's at our HearingLife shop. So if you visit our shop to purchase accessories, you will receive 5 miles for every $10 that you spend. And here's the big one, 1,000 air miles for a hearing aid purchase. So if you were on the fence about getting hearing aids, or you know you need them, and maybe this is the month, May is the month to do it, because you're going to receive 1,000 air miles with your extra air miles with your purchase. I mean, that could be a trip. So it's hard to accumulate 1,000 air miles in one transaction. So take advantage of it and make May the month that you decide to do something. It'll be worth it in terms of the rewards. And just wanted to let you know that in the month of May, you're going to be seeing, if you follow us on Facebook or Instagram or any of our social media platforms, you'll see this switch life on. And I love that, because I really feel like treating your hearing loss, and if that's with hearing aids, that's essentially what you're doing. Those who have hearing loss and are struggling are sort of living and hearing life on a dimmer switch. It's dimmed, it's lowered, the light is very, very faint. And we want to switch that light back on for you. We want to switch life on. And it really is, that's sort of the feeling of when you wear hearing aids, everything is bright and clear and noticeable again and audible. You can hear it again. So it's like switching life on again. So I want to thank you so much for spending this time with me and attending today. Very happy that you came. I hope you learned something new. And I'm going to just stop sharing my screen and see if we have any questions. And see if what we've got here for questions. So I have a question here that I'm going to answer here. Alice is asking what to do with very loud tinnitus. So this is somebody who has a severe case of tinnitus. That's a great question. Thanks for asking. And for those who are tinnitus sufferers and who do not have hearing loss, the treatment options are a little bit different. Of course, I would say definitely if you have hearing loss, you want to treat your hearing loss and see if you notice any positive benefits as a result of treating your hearing loss. So if you start wearing hearing aids and you notice an improvement, that is great. There are also hearing aids that have specifically a tinnitus program. Now, hearing aids are digital now. It's a computer chip, and you can have hearing aids that have a dedicated program for tinnitus, and it plays, masking sounds, different sounds, and that can also be a form of treatment. So that would be my first recommendation. If you do not have hearing loss, then the conversation is a little bit different. It would be other forms of treatment. There are, easier, simpler things like using maskers, like tabletop maskers, or listening to audio sounds files to help reduce the presence of it, or at least how you're noticing it. There's a lot of treatments that we call sound therapy, and they can be very effective. There are also some other treatments that are more like cognitive behavioral therapies, and that's when we really try to focus on almost retraining your brain to either not detect the sound anymore, or even when you do detect it, to not invoke the negative feelings that it comes with, feelings of frustration and really fixation on the sound. So that is a little bit more in depth and sort of more intense, but these are all the things that will be discussed with you if you come in, or if you decide to do a video consultation. So I would highly recommend that you come and see us, or speak to a hearing healthcare professional, and we'll give you the options available. Hope that helps. Okay, someone's asking, how can we encourage people to wear their hearing aids? I think there's actually two questions there. I will talk about that one first. You are right. It is hard to force somebody to wear their hearing aids. You have to have some motivation, some internal motivation. And I would just say that trying just to be supportive and helpful and identify what the roadblocks are. Why does the individual not want to wear hearing aids? Is it a physical thing? Are they having trouble putting the hearing aid on? Do they not like the way the hearing aid sounds? Are they forgetting? Are they having trouble with care and maintenance of the hearing aid? So if we can identify why somebody's not wearing their hearing aid, then maybe we can help fix the problem or guide them with support. And if it's just a sheer lack of motivation, then it might be having that difficult conversation of saying, look, your hearing loss affects other people, not just you. And when you don't wear your hearing aids, you're not hearing other people. And it's really difficult to have conversations, and we want to talk to you. So, we really want you to give this a try, because we want you to hear better, and we want, we want everyone to be able to communicate with you. So maybe having that sort of conversation. So someone's also asking, is it bothersome to wear hearing aids and then also wear a mask, or if you wear glasses? So the answer is that wearing glasses and wearing hearing aids typically isn't a problem. The hearing aids nowadays are pretty lightweight, and there's lots of space behind the ear if you do wear glasses, that a hearing aid can fit back there as well as your glasses. You may have difficulty if you have a really thick frame, and so I typically recommend switching frames to something that's a little bit thinner to give more area, more space back there for the hearing aid. But totally doable, not an issue. You can wear hearing aids with glasses. Now with masks, what we get concerned about and what we know can happen is that when you're removing the mask, the hearing aid, you're dislodging the hearing aid. So we have actually expanders, little clasps that you can attach to a mask to make sure that everything stays in place and that your hearing aids are secure. So you can get them online at the shop, or you can come in and see us. We carry them in the clinic as well. So I think that's the only questions that were not answered, as Patrick was monitoring the questions. So I think everything else he probably answered, and those are the only two that came to me. So thank you so much. This has been wonderful. I hope that you learned something. Thank you for allowing me into your homes. And I'm sure I will see you next time, because this is our reality. And virtual Facebook Lives is a great way to get information out to you. Finally, just as my last send off, I want to encourage you to check our website. There is so much great information and links to all kinds of things, to book an appointment, to do an online test, to learn more about tinnitus, to access our hearing aid help resources. So to go to that website, you can get to all of it from our website, which is hearinglife.ca. So if you don't know where to go, just go there, and you'll basically be able to navigate through everything. We are here to help you during this pandemic, after this pandemic. We are here to answer all of your questions and to get you the help that you are looking for, if you're looking to treat your hearing loss or just find out if you have hearing loss in general. I hope you are all safe, be well, and I'll see you next time. Take care. Bye-bye.